Good evening. This video is again a continuation of the previous videos regarding the station 3 of afternoon Viva for the DM final exams. As with the previous video, I could not arrange the particular image or the slide to describe it. Since the exams are nearby, I will go through only the questions which are possible that you might be encountering in your exam. Histopathology station, where you will be given slides and the microscope, mostly in almost all the institute where the DM nephrology final exam occurs. Mostly they give the microscope and the slide where you yourself have to do the adjustment and make the diagnosis. In few center they might show the slide and the PPT where you have to say the findings over there. That will be bit easier, but if institute gives you the slide and the microscope, you have to be prepared to tackle those questions also. So microscope, the basic detail you should know: where is the eyepiece, what is the lens over here, what is the magnification. There are four the small viewing area, this resolution, four different resolutions will be there. Definitely the question will be on that, and you should know how to adjust this, how to adjust these tables, adjust the power of the light, and how to keep the slide and try to locate starting from the scanner view and up to go to the high power view. The first question definitely it will be regarding the resolution of the microscope. You will be having four lens. First one is 4x, 10x view, 40x view and 100x view. 100x is for oil immersion. 4x, what is this x? X is the eye power lens, which is 10 times magnification, which is 10. So 4 into 10, 40 times magnification. It is for scanning view, scanning the core of the kidney biopsy. 10x, also called the low power view, 100 times magnification. 40x is high power view, which is 400 times magnification. 100x is oil immersion. You won't use that in the normal kidney biopsy samples. So make sure you are able to tell this resolution. The scanner view is at 4x or 40 times magnification. The X high power is 10 times magnification. Next, they will ask what is the low power, what is the high power. In the low power, you can see the number of glomeruli. Gross structures can be seen in low power. To see the glomeruli in detail, high power have to be switched to, which is 40x. Low power is 10x. Then in the screening, what are things you have to see? In the screening, the core of the kidney biopsy specimen you have to describe. What is the stain if possible, otherwise the number of glomeruli you have to tell how many glomeruli you are able to see. There might be a question related to sample processing, how many days it takes, how to process the sample, what are the steps in processing it. This question, if the examiner wants to assess your theory knowledge, they might ask how the sample is being processed. And another specific question might be related to the location of the biopsy samples and the number of glomeruli required to diagnose a particular condition. For example, even a one glomeruli is enough to diagnose membranous nephropathy. For the focal lesion to diagnose, if there are 25 glomeruli, there is a 95% chance you will detect those. These are some theory points. And with respect to the location of the biopsy, if it is subcapsular, there will be over-representation of the global sclerosis. If the juxtamedullary glomeruli are there, these are the things which are first involved in FSGS. And the medullary tissue might require to diagnose polyomonephropathy. These are the beginning questions, theory questions. Whenever there is a microscope, there is a slide. These are the theory point you have to remember or you might encounter. And after doing the renal biopsy, how to send the sample? For electron microscopy, a 1 mm tissue might be enough. For light microscopy, the 2/3 of the core to be used. For immunofluorescence, and an average 3 to 4 mm ideally is required. So this is how you will cut the biopsy sample. And one question related to it is how to cut it. Like whatever the process that you are doing, you can tell on a glass slide with a clear cut scissor. And theoretically, how the pathologist cut is a separate question. I'm not discussing that in detail, but on if you are having this practical exam and if they ask, you can tell you usually after the biopsy, keep the core in the slide, glass slide, and cut it with the sharp blade. Another important and the most common question you might encounter is what is the fixative that is used for the preserving the core for the light microscopy, that is formaldehyde or formalin. The alternatives you have to know. Basically, it is an alcohol-based preservative. If you are suspecting any crystallopathies, then ethanol can be preferred also. What is the preservative for immunofluorescence? It is normal saline. What is the fixative for electron microscopy? Glutaraldehyde. And the next most important one is what are the stains used in light microscopy? Eosin and hematoxylin, periodic acid shift, silver methenamine, Mason trichome, Congorite, one cosa. These are the specialized stain, and these were all the basic stains. And you should know what color it appears, what are the structure it stains, which stain is used for which condition. For example, silver methenamine is used better to diagnose the membranous nephropathy. These kind of question you might encounter. With respect to the first question, what are the steps involved in if the biopsy sample is sent to the pathology lab? What are the steps the pathologist will do? The pathologist will do processing, then they will do sectioning, then they will do staining. On an average, it requires around 5 hours for light microscopy. For immunofluorescence, it might average 2 to 6 hours. For electron microscopy, to complete this, it might take 2 days also. Since the exams are in next week, rather than going into the theory of these things, if you are able to tell these three answers, sample you were doing in the nephrology ward or wherever it is, and you are sending to pathology lab. In the pathology lab, there will be processing, sectioning, and staining. These are the three important steps. Electron microscopy, one question you might encounter is what are all the conditions where only electron microscopy can diagnose? Kidney condition, where biopsy, electron microscopy is compulsory. What are the conditions where electron microscopy is not required? These are the questions you might encounter. And what is the salvage technique? For example, if only we have sent the sample for light microscopy and immunofluorescence, and if we want to do electron microscopy later, once the diagnosis comes, then you want to see the electron microscopy finding, then how to salvage the sample for EM? These might be the difficult question. If they are asking this question, probably they want to select the students for the highest mark or the gold medal. This kind of question you have to be aware of. This I will try to come up with a separate video because the explanation is very big and it will take a lot of time to explain it. If you have time or if you are known, just revise this. What is the salvage technique? And in the biopsy, how to differentiate between necrosis and sclerosis? What is it? Which stain can differentiate? Because in many biopsy, IFTA is most important and you should know how to calculate IFTA, how the pathologist calculates the IFTA and mention as percentage. Next question might be when to say glomerulomegaly. The answer I am telling here, if in the high power, if you are able to, if ideally you will be able to see a one glomeruli. If you are not able to see and the one glomeruli occupies the entire field, probably there is a glomerulomegaly. and it's a relative term. There is no absolute definition to say glomerulomegaly based on the microscopic finding. You might encounter when to say active lesion. There should be proliferation, cellular crushing, necrosis, and edema. All indicates active lesion. Definitely, there will be questions on type of cast and how to differentiate myeloma cast and other type of cast. How to differentiate. Most important, nodular glomerulosclerosis. The slide might be containing nodular glomerulosclerosis. They might ask the differential like diabetic nephropathy, amyloid, MIDD, the differential and which stain to differentiate it. Nodular glomerulosclerosis is very important. Either Google it or ask from your pathology friends, or you might be having slides to see what is glomerulosclerosis. Otherwise, I have uploaded a video on diabetic nephropathy. You can see that nodular glomerulosclerosis finding and what are the stains used to differentiate the various differentials. And what is mesangium? Mesangium usually located between the three capillary loops. These kind of basic question also you might encounter. Mesangium, they might ask you to locate in the microscope, so be prepared for it. PCT and DCT, what are the cellular structures by which you can differentiate? For example, you are seeing the tubules, they might ask whether it is PCT or DCT, how to differentiate. Sclerosis and fibrosis, what is the difference? What is the collagen type? Which stain used to differentiate? FSGS, how to diagnose? The hierarchy: first rule out collapsing, cellular, hilar, tip, then go to non-specific variant. This order is very important. Your slide might be containing the collapsing FSGS. So this you have to remember it before going to the exam. And whenever you are given the slide, if they ask you to describe, always start with which power you are using, what is the stain you are seeing. Always go from periphery to center in the glomeruli, starting from the either capillaries, Bowman's capsule, then vessel, mesangium, endocapillary. Go stepwise and describe about the interstitium, finally describe about vessel. So this is what the examiner expects, how you are going to describe the slide. The scanner view or low power or high power, whatever the important, don't just directly jump into the diagnosis, because they are not interested in getting the diagnosis, they are interested in seeing your approach. Okay, then there was a question in during my exam. They asked what is interstitium. Interstitium is nothing but supporting tissue of the renal parenchyma. It is the space between glomeruli, vessel and the tubule. The cells containing like fibroblast, proteoglycans, glycoprotein fluids will be there. The contents of the cells like fibroblast. And whenever there is inflammation, there will be inflammatory cells. These kind of basic questions also you might encounter. The students might find it difficult to answer this type of basic question than the difficult one, so get prepared for this also. Another common question: what is crescent, what is pseudo crescent, how to differentiate, and Mason trichrome, what are the three colors and what are it being used to, which cellular structure is being used to diagnose that. And you might be given these kind of direct slides also. They will ask which stain it is. I thought of keeping a slide of all the images, but since I could not get the time in this video, I didn't keep, but I will try to come up with videos showing all the stains. Here I have got the methenamine silver stain, where you will get blackish things, where whenever this kind of stains is there, most likely the diagnosis will be membranous nephropathy, considering your exam point of view. And a few questions might be related to direct immunofluorescence. They will ask the difference between direct immunofluorescence and the indirect one, how to stain the intensity, where are the locations possible, what are the patterns you will see, and regarding the location, where the locations can be, what are the significance, what are the extra capillary, extra glomerular location which might help. These are the few questions you might encounter related to direct immunofluorescence. The question will definitely go into kappa and lambda deposition, significance of that regarding those things. Just have a look of this staining intensity when to say significant and all. So the possible slides the examiner usually gives is be prepared for normal glomeruli also, because in the exam tension you will be searching for the diagnosis, but it might be a simple normal glomeruli. So make sure you have seen the glomeruli, you are able to identify the structure or not. For that, microscopic adjustment is very important. At least try to practice. If you have any access to microscope in the department or go to pathology department, just have a look at how to do the adjustment. There is a high chance you will get crescentic GN, cast nephropathy, because they will ask you to identify eosinophilic cast, which are, because these are the easy things to identify in the slide. Amyloidosis, collapsing amyloidosis, nodular glomerulosclerosis will be there, because the three differential diabetes, amyloid and MADD, you should know which stains to use to differentiate. Collapsing GN, diabetic nodules or wire loop lesion, these are all the common spot diagnosis slides the examiner might come with. So in the histopathology slide, if you know these pages, don't do any mistake in description of the slide. In the Viva, rest is not about the diagnosis, it is about your approach, and try to make a notes, because after your case presentation you might have forgotten what you might have studied 1 week back. So just have a note down all the importance point related to histopathology, because histopathology might be the first station you might be entering as per the order. So you will be bombarded with these kind of questions. And with respect to the immunofluorescence and electron microscopy, your Viva might not have covered much of it. So expect most of the question from this side. And regarding the stains also, you might not have any much theory questions, or during your case Viva you might not have encountered the question. So all these questions are about to come in this afternoon Viva. Prepare for IgA nephropathy, prepare for FSGS, wire loop lesion, what is it, how to see and all. So if I have time, I will try to keep the real-time images of those slides and describe those, how to identify which stain and all. So that's all regarding the station 3. Next video we will see regarding the station 4. Bye bye.